Good afternoon, everyone. I'm Bonnie Coyle. I'm the Director of Community Health at St. Luke's Hospital, and I'm really pleased to be here this afternoon to say a few words to you about the United Way campaign and to tell you a little bit about some of the programs that I am associated with. Sit back and picture a nice 6-month-old baby girl. Y'all got that vision in your head? Okay, now, I want you to visualize that baby girl, 6 months, with 11 fractures. Go ahead. Can you do it? Did it disturb you? We've met that little girl. She's referred to our program. She lives right here in Northampton County. Injuries were inflicted by her parents. We're working with her in one of our programs that works with children and youth agencies. That's the kind of thing that the United Way programs are trying to stop. She's not the only one. We work with quite a few other kids, very similar to her. One of the first 2 programs that we have that are funded by United Way, both NFP for Nurse Family Partnership and PATH for Parent as Advocates in the Home, are specifically working to stop that very kind of problem. Babies who are being abused, treated badly, not getting a good start in life. One of the main goals, United Way, give every baby a good start in life. Nurse Family Partnership and PATH have trained nurses and community health workers that go into the homes to work with high-risk moms, providing parenting education, connecting them to health services, getting them connected to social service, health insurance, making sure the babies get their immunizations, focusing on whatever needs have to be done to make that baby healthy. These programs have great outcomes. One of the outcomes that the United Way makes us show them is that we're reducing low birth weight amongst those moms that we work with. We work straight with them right up to the baby is 2 or 3 years old. We are making a difference. Right here in the Lehigh Valley, you may not be aware, but we have one of the highest low birth weight rates in the state and the nation. Okay? The program that we have with NFP and PATH, working with high-risk moms, has lowered the low birth weight rate locally with the moms we work with to less than the national average. And this is in a group of high-risk moms. Okay, you can make the difference. You can make changes in these individuals' lives if you put the right programs in place. Not only are we making sure these babies are born at a good weight and getting off to a good start, but in the 2 years that we've been funded by United Way, serving more than 500 families, not one single case of child abuse has been reported amongst those families. So we're preventing those cases that I started out with here. One of the other measures that United Way asks us to do is to increase the number of children in 3rd grade reading at grade level. Now that's a critical measure. United Way knew what they were doing when they picked this measure, because a child who doesn't read at grade level by 3rd grade, research shows probably will not graduate from high school. Also probably will wind up in prison. Now, we don't want to have all these 3rd graders wind up in prison. We want to help them. And so one of the programs we have through United Way, where we've adopted Donegan, we take medical and dental van services to them. We have case managers at the school working with them. We have reading programs in partnership with Lehigh, working very closely with these kids to help them. We've been doing the program for 2 years. When we started, 80% of the kids at Donegan were reading at least 1 grade level below grade, and 50% were reading 2 grade levels below the grade they were in. Lots and lots of kids at risk. In just 2 years, we took the 80% not reading at grade level and dropped it all the way down to 40%. Okay, we cut it in half, 2 years. You give us another 2, 3 years, we're gonna have that down to virtually 0. If you put the energy and the effort in, this is the kind of success you can have. It makes so much more sense to invest our dollars and help these kids in kindergarten, 1st, 2nd, 3rd grade than to put our money into building more prisons. Last program I wanna tell you about. Let's say we missed the little 6-month-old baby girl. She didn't get into Nurse Family Partnership and PATH. She didn't get picked up in the Donegan program. program or at Roosevelt, the United Way also has, further along the continuum of providing care, safety net services. If this girl doesn't get help, she's likely to wind up abusing drugs, pregnant, and possibly with HIV disease. We have a grant from the United Way to help our HIV positive population to finally get them back on track, helping them become self-sufficient, getting the care they need so they don't again wind up another statistic back in the prison system. So the beauty of what the United Way is trying to do is build this continuum of services so that we as the Lehigh Valley can become the healthiest place to live in the country by building the programs and the opportunities for every single person in the valley to have a healthy start, continue with that, and then even have safety net services in place. It's difficult, difficult work, and it requires partnerships like we have with Donegan and you have with Roosevelt, and partnering with many other agencies, but the work can be done, and it's starting to make a difference with some of the examples that I shared with you. I've been working with the United Way for many years. I give, I advocate, I volunteer, and I encourage and invite you to all join with me so that we can make the Lehigh Valley the healthiest place to be in America.